Awesome. Hey everyone, welcome back to another session. Today we have Dr. Judy, and I'm so excited to hear more about her journey and how she became a pediatric dentist. So without further ado, take it away.
Hi, everybody. I hope you guys are having a great Friday. At first, I'd like to thank Fresh Dental Shadowing for inviting me to hosting this and then inviting me to do this talk. Today, I kind of want to focus, you can see the title of my talk here. I really want to focus on things that you kind of can't find on the internet. Everyone knows like the requirements you're supposed to take in order to get into dental school, into your specialty. But I really want to kind of focus on things that people don't tell you about being a pediatric dentist. So I'm going to go into, the good, the bad, and the ugly to give you really like a well-rounded perspective of what you can expect in this field. So I'm just going to go through just the general outline for today. I'm going to talk a little bit about my educational background. And then in that, I will discuss things that I wish I had known in picking dental schools, specialty programs, and just things that my colleagues feel like they would have known when they were making that decision back then. And then I'll talk a little bit about pediatric dentistry, what we do clinically on a day-to-day basis. And then I'm going to go through a typical work day and a work week so you can kind of see the lifestyle involved with being a dentist in general. And then the crux of the lecture, which is everything that they don't tell you about being a pediatric dentist. So that'll be kind of fun. And then last, we'll save some time for a Q&A session, okay? So about me, I'm Dr. Judy. I am a pediatric dentist, and I've been practicing for about 2.5 years in California. And I do practice in a very high volume private practice, which means I see anywhere, depending on the seasons and when kids are out of school, I see anywhere from about 75 to up to 100 patients. And that sounds like a lot, but I promise it's definitely doable, but it's very, very busy. And then private practice, I don't know if you guys are familiar, but there is a private practice and corporate. Although I do work in a private practice setting, it does kind of function as the practice I'm in does function as a corporate, and we can kind of go into the differences of private practice versus corporate dentistry as well later on. So my educational background, I went to undergrad at UC San Diego. I majored in human biology and I minored in healthcare social issues. And then I did take a 2-year gap in between undergrad and starting dental school. And the main reason was because all of undergrad, I was actually pre-med. So it wasn't until I was a 4th year, almost graduating, I took the MCAT and everything, and finally decided that it wasn't the lifestyle for me. So I took a gap year. Actually, it ended up being 2 to kind of explore what I wanted to do. Now, I knew that I still wanted to be in healthcare. I just didn't know which avenue. And, I had interest in dentistry when I was in high school, but that kind of fell off the wagon when I was so focused on medicine. So it took me about 2 years to really solidify my choice of pursuing dentistry. And in those gap years, I interned at a pediatric dental office and I had multiple part-time jobs. I was an after-school teacher. I was an SAT tutor. I did everything under the sun. And if anyone is considering a gap year, I highly, highly recommend it. If you're even like slightly thinking about it, I highly recommend it. Just because when you think about it, we all start school when we're 5 years old, kindergarten, preschool. If you're going to go into healthcare, you're going to be in school for 30 to 35 years. So this is really the only time in between, I would say, college and starting your professional school that they won't kind of ding you for it. They won't think that that's kind of funny or like question why that was. So if you're considering it, I highly, highly recommend it. Okay. So like I said, I did 2 years gap year, and then I started dental school at UCLA. And in terms of dental school, I do recommend if you have obviously the goal is to get into a school so you can kind of kickstart your career into dentistry. But if you have the choice, I would highly recommend that you pick an in-state public school or any school that offers you some type of scholarship, just because the weight of the loan that you're going to live with after is a big deal. And I know at the time you just kind of want to get into the best school, the highly distinguished schools. But now in retrospect, luckily I went to an in-state public school. So my tuition was hefty, but not as hefty as it could have been if I picked a private school. So now a lot of my colleagues are having to pay back this hefty loan, and they kind of wish they picked a school where the tuition wasn't as hefty. So that would be my number one tip if anyone had to ask me what are some factors going in a dental school. If you had a choice, I would definitely pick the more, cost-effective school, because in the end, we're all going to be dentists anyway. And then I did choose to do a specialty, and my pediatric dentistry specialty was 2 years. And in dentistry, it can range from 1 year all the way to 6 years if you're depending on which specialty you're interested in. Mine was 2 years, and again, I picked a program that was cost effective. So I did look at programs that were paid. So specialty programs, you either pay them or they pay you, or it can be a hybrid where you pay a tuition and they pay you a salary, and that kind of evens out. So I picked a fully paid program. And another thing to consider with specialty programs is if they are clinically based or if they're didactic. So I picked a very clinical based program, which means you work closely with the hospital and you see a range of cases, trauma cases, special needs patients. So you really get a big range of the type of patients that you would see. Maybe you wouldn't see them in a private practice setting, but it's great to have that knowledge under your belt as you're training. Versus a didactic school, which is heavy on the books and they're more research based. So if you're kind of interested in, being a lecturer for a dental school, or you're very research based, a didactic heavy school would be a good choice for you. So that was my educational background, and we're going to go into what I do on a day-to-day basis. So what we do. So this is the bread and butter, I would say, of my day-to-day clinical routine. So we have what we call recall appointments. Recall appointments are basically your normal checkups. So when you go to the dentist every 6 months, we call those recall appointments. And in those appointments with children, we mainly do a cleaning, a radiographic examination, which are x-rays, and also a clinical evaluation. And then in the end, we do education, depending on what we see, we give parents some advice and some anticipatory guidance on what they can expect next in their child's growing jaw and like developing teeth. So depending on the practice, sometimes if it's a slower practice, you'll be doing the cleaning. If it's a more busy practice, like my practice, the assistants will do the cleaning. So in a recall appointment, if you're the doctor, you're probably with the family for maybe 10 to 15 minutes, depending on if they have a lot of needs and you have to discuss the treatment plan with them. So what you'll normally be doing is you're going to be looking at x-rays all day, and you're going to do a clinical exam on every single patient. And then there's a big portion of talking to parents about what advice to give them on brushing, and just depending on the stage of the patient, advice for parents, considering how old the patient is. So those are the recall appointments. So anytime you hear me say recall, it's just a normal checkup, cleaning, and x-ray evaluations for any abnormalities or cavities that a child might have. And I would say recall appointments are on a day-to-day basis, I would say 50 to 75% of the patients you see will be coming back for recalls. Now, the other 25 to 50% are treatment appointments, which are this. And, anytime you specialize, you're going to be working with very specialized techniques. So you're going to be doing the same thing over and over and over again, unless you're a general dentist who can kind of see and do everything under this umbrella of dentistry. But in pediatric dentistry, we basically, our treatments fall into 4 things. One is just normal fillings. We're filling cavities with white color fillings. Two, we're for deeper cavities, we're doing what we call a baby root canal with a crown. And then last is extractions. Okay, so I don't know if you can see this little pink nose here. Anytime we do treatment on pediatric patients, I would say 75 to 100% of the time we will be using nitrous oxide, which is what we know as laughing gas. And it just kind of helps calm patients down. If they're a little nervous, it kind of takes the edge off. It doesn't make you go to sleep or anything. And surprisingly, it doesn't make you laugh. I would say only like 10% of the patients actually have this like this giggle and laugh all throughout, but it just kind of helps relax them. Sometimes they might feel a little sleepy. They might feel like they're kind of floating on a cloud. So that's pretty safe. And I would say if you go to a pediatric dental office, they will offer this if your child needs treatment. And then for the more advanced techniques, so a lot of people don't know this aspect of pediatric dentistry. If a patient comes and they're highly anxious, they have a full mouth of decay, they're already in pain, and they just, for some reason, if whether they're too young or they have special needs and can't sit in a dental chair to do treatment, we do advance to these type of sedation options. Now, like I said, nitrous oxide is a type of sedation, but it's the safest and most minimally invasive because you're still awake. So the next step up would be right here where you see oral conscious sedation. This is kind of when we do the dentistry when you're kind of asleep. You're still able to breathe on your own, but you just drink a little bit of medicine and you feel kind of knocked out. You might get a little limp. You might even sleep. So it's not a cure all. It only works on certain patients. If they're highly anxious and they know what's coming, it's not going to work very well. So it's kind of a wild card. And some offices offer that. I personally don't do oral conscious sedation because it's so unpredictable, but that's one option that that kids can do if they need it. And if you kind of think about it, it's kind of like when you're asleep. You don't really have your reflexes when you're sleeping, but if someone touches you or pinches you, you react to pain. So that's kind of what oral conscious sedation is. And then the next step up would be general anesthesia, and that's kind of the ultimate type of sedation a kid can undergo, and that's when you're quote unquote being put under. So this can be done in an office setting where an anesthesiologist comes to the office that you're currently working at and they help you put the patient under. So you as a pediatric dentist never put the patient under. You have to work with an anesthesiologist. And then once they're under, then you can do all the dental work when the patient's nice and comfortably asleep. Okay. And then however, not all children can do in-office general anesthesia because we want to make sure it's nice and safe for them. So if they have any pre-existing conditions, or if they are, obese, overweight, any complications that we can foresee, we want it in a very safe setting, which would have to be in a hospital setting. So a lot of people don't know that dentists actually work in the hospital. So we do this in an OR setting, very sterile, and I do this more in residency, but I know pediatric dentists, my colleagues they have affiliations with the local hospital and they go in maybe once or twice a week to do cases in the OR. So those are kind of your general treatment options. And I would say, like I said, most of my practice is in the office. I used to do, I would say in-office general anesthesia once a week. Now I'm down to just once a month. So if that's something that you like, then you can obviously add that to your schedule more often. But I'm usually in the office treating patients when they're fully awake. And then, so a lot of people actually ask me, I don't know if Yara's tuning in, but she reached out to me. She's a pre-dental student as well. And she asked me whether pediatric dentists get to do aesthetic cases. Now, I know a lot of people are attracted to dentistry because there is an artistic aspect to that. You get to work with your hands. You get to kind of mold the teeth and make it like look brand new again. But in terms of pediatric dentistry, I would say aesthetic kind of falls by the wayside. When you're dealing with children, your main goal is just to get them out of pain and to treat their cavities. So I would say 90% of pediatric dentistry is behavioral management, not so much the artistic aspect of dentistry. But there are some cases where aesthetics do play in, and it's mainly with the front teeth. So here you see strip crowns and zirconia crowns. Anytime you have cavities in the front, when they're pretty large and they affect the smile line, you will see like a gray shadowing, and you will see basically a piece of your tooth that's missing. So we have cases like these where we take out all the decay and then we restore them with what we call either strip crowns or zirconia crowns, and they look beautiful. A lot of people who shadow always say that this is their favorite case because they get to see the direct results, and it's very rewarding. But as a pediatric dentist, I would say these are the cases that I dread, because unless the children are really good, it's really hard to get such good results and very little bleeding. So whoever did this case did an amazing job. It looks great. I'm wondering if when we do these cases, they're usually under general anesthesia, because any restorations in the front, they are very technique sensitive. So if you get one like drop of blood on the filling, it can pop right out. So I'm wondering if they did this under general anesthesia or if the patient was awake, because they did an amazing job. And then another aesthetic case would be trauma cases. So obviously kids are, learning how to walk, they fall, they in their teens and in school, they play sports. So I see a lot of trauma cases, and they do come in with some fractured permanent teeth. Now, if they're permanent teeth, it's a totally different ballgame. We want to save those teeth and try to, these teeth need to last your whole life. So we always do our best to try to save them when they're permanent. So sometimes you would have a trauma case where you would just immediately do a restoration, and they come in looking like this with a really severely chipped tooth, and then they come out with a tooth looking just brand new, like nothing happened. So those are the cases, that's as the extent of aesthetic cases as we get in pediatric dentistry. So if you're, into the aesthetics, I would say a general dentistry would be your best bet, and you can kind of specialize in cosmetic dentistry. So let's go into a typical work day or week for me. So obviously, as a dentist, one of the pros is that you get to make your own schedule. You get to work as much as you want. You get to work as little as you want. So I chose to work 4 days a week, Monday through Thursday, so that I get a 3-day weekend every single week. Now, you'll see that 2 of the days I work an extra 2 hours. So a normal work week for a normal individual is a 40-hour work week. I actually work 36 hours in total. So, those Mondays and Wednesdays are those long days, but it makes up for giving me a free Friday. So I definitely love my schedule. And I have friends who are, go-getters right out of residency, who work 6 days a week. So, they're really determined to pay off their loans. So they're young, they have the energy, so they can choose to work 6 days a week, but you can work as much or as little as you'd like. So that's my typical work week. And then my typical work day kind of starts off at 7:45 every day. We do what we call a morning huddle, which is the first 15 minutes before patients get here. We kind of have the staff come in. All of us are there, and we have a little meeting about our patients that we're going to see for the day. So, and during these meetings, we talk about any special needs, if patients have any medical history that we need to be aware of, if they request private rooms. So we just kind of go over everything, make sure we're all on the same page. And then from 8 to 11:30 or 12:30, depending on my long or short days, we just do the bread and butter, recall appointments and treatment appointments. And like I said, recall appointments are about 75% of your day, and treatment is about 25% of your day. And then I get an hour and a half lunch to kind of re-energize myself, and then do it all again for the second half of my day. Okay, so let's get into the stuff they don't tell you about pediatric dentistry. And of course, we'll start with some the good. So like I said before, the best thing about dentistry is you get to work as much as you want or as little as you want. And it really serves as a great work-life balance. Now, depending on your personality, I personally have a lot of hobbies that I like to do on the side. So those Fridays off, those 3-day weekends really help me kind of balance everything out. Now, pediatric dentistry is very grueling. So it does, those 3-day weekends do re-energize me to get ready for the next work week. So it's an amazing work-life balance situation. And then obviously, anytime you're specializing, you'll get compensated pretty well. Now, in terms of, I know there's a discussion between general dentistry versus specializing. If you're a general dentist, I would say the compensation is not as high as a specialist. And I know a lot of people might wonder, oh, when you're in dental school, it's a long 4 years. You've already like been in school for 30 years. You kind of just want to get out and make money. But if you're thinking about specializing, I highly recommend it because the payoff is extraordinary. I would say most specialists in dentistry make double or 3 times, even 4 times the amount of a general dentist. So that's something to consider when making your decision. And then third, it's the ability to own your own practice. Dentistry is a very special field in healthcare where you can be your own boss. You can own your own practice. I have no desires to, but people who are business minded love the fact that you can own your own business. And like I said, as an associate who works for someone else, you get compensated well, but when you're owning, it can be a very lucrative business. So that's also something to consider. Okay. And then last, it's just a rewarding field to be in. You get to work with children. Children make your life so interesting. I think I have a funny story every day to tell because children are so unpredictable. And then also you just get, it's very rewarding. Sometimes parents come to you as the last resort, and you can really feel that they're really appreciative that you're helping their child. So anytime you work in the healthcare field, it's just very rewarding, that direct patient interaction. And then also with dentistry, like I said before, you see direct results. They come in with a large cavity, and then once they leave your office, their tooth looks brand new. So if you're into seeing direct results, it's really satisfying in that aspect. So let's get to what people don't tell you about pediatric dentistry. So a lot of people go into pediatric dentistry thinking that, oh, I don't want to deal with adults. I only want to see kids. And most of it is true. Your patients will be kids, but a majority of your interaction are with the parents and families. So that's one thing that people don't or kind of just forget, that, children, they're children, they can't make decisions on their own. So you need parental consent. So every treatment plan that you come up with, you have to discuss with the parents, and you have to make sure they understand all their options. And sometimes, you have to have these difficult conversations with parents. They're trusting you to care for their children, so they can get, pretty protective of, what they want for their children. And as well as, being respectful of people's wishes due to, their beliefs, their religion. You have to be mindful of that, even though scientifically, clinically, and as a specialist, what's best for them dentally. You want to keep that in mind, that you have to consider, their beliefs and their wishes. So you got to be mindful and respectful of that. And I would say, the tough days in dentistries are days when parents are not happy with you. So dealing with adults is a big part of pediatric dentistry. So that's one thing that a lot of people don't think about. And then, dentistry in general is physically taxing, especially pediatric dentistry. I have colleagues with neck pain, back pain, joint issues, carpal tunnel. When you think about it, you're working in a small space. The oral cavity on a child is very small. So most children can't sit still for more than 10 minutes. So, they're moving around, and as they're moving, you're moving along with them. And sometimes you're contorting your body in a way that's not natural, and you will feel it by the end of the day. So if you're doing that for, 8 hours long, 10 hours long throughout the day, it is physically taxing on the body. And then one thing that people don't consider is that how mentally taxing it can be. Like I said, I work in a very high volume practice, and I am constantly talking all day long, straight talking. And, when you work with kids, you have to have this high energy. Kids really feed off of your mood and your energy. And, sometimes when you're having a bad day or you're dealing with something personally, it's really hard to put up that high energy, but you have to do it for the sake of your patients. You want them to have a great experience, and you don't want your personal life to affect your professional life. So when you are working with kids, you always have to have a smile on your face. You always have to keep up this high energy. So when you're doing it for the whole day, by the time you get home, I really don't want to talk to anyone. So it's one thing that people don't talk about. Obviously, if you're working in a slower practice, you have a more downtime, so it's not as mentally demanding or physically taxing, but it can get to that point. And then one thing to keep in mind is a normal day at the office is screaming, crying children. And that's something, I have a lot of people come into the office and we have a crying baby, and I'm just like totally, it's tuned out. I learned to tune it out. I don't even notice it. And then people are alarmed that they're like crying kids, but that's a normal part of pediatric dentistry. They're not, they're crying because they're scared. They don't know what's going to happen. They're anxious. So it's totally a normal part of a pediatric dental setting. So that's something to definitely get used to. And then the ugly, this is just for fun, but it does get pretty, ugly sometimes. Like I said, crying is every day. You have to expect that every day, but there are rare occasions when you get the biting, you get the vomiting, you get the bodily fluids, especially during like flu season. You have kids with snot all over their mouth, and then vomiting, with the laughing gas, they can have a negative reaction to it. So I've definitely been vomited on, projectile vomited multiple times. So that's not uncommon. So I've had a colleague get peed on with when they were doing an exam on a baby. So, don't be too, grossed out by it. It's just a normal aspect of working with kids. And then, so to wrap it all up, obviously there's good and bads of any profession, but it's good to be aware of the bad so that you can, as long as you're okay with it and you can deal with it, you're going to have a great time. Obviously the good far outweighs the bad. If I had the opportunity to do it again, I would pick pediatric dentistry 100 times over. So you really got to, outweigh your pros and cons. And for me, the good definitely outweighs the bad. So yeah, that's my talk in a nutshell. So if you have any questions, feel free to ask me. I am very active on social media. I kind of share dental tips for parents. I also kind of do behind the scenes look of a day in the life of a pediatric dentist. And, a few people have DM'd me about what it's like being a pediatric dentist. So feel free to hit me up on Instagram. I'm very active on social media. So let me know. But yeah, I'll throw it back to you for any questions or that I can answer.
Yeah, that was amazing. Amazing. First of all, thank you so, so much. I really enjoyed that. Thank you for like telling us, the truth and just hitting us with the facts because I think it's better to learn now than further along the road.
Oh,
But we do
definitely.
have some questions. Okay, so I'll start with kind of your educational journey. So you said you did residency. So what would you say is harder, dental school or residency?
Oh, definitely 100% dental school.
Yeah.
Because in dental school, you have to kind of learn everything under the sun. So I don't know if you guys know this, but right after dental school, you can practice dentistry. You don't have to do like in medicine, you have to do another 4-year residency and then you specialize. But right after dental school, you have free reign to see patients. Actually, you see patients as a dental student.
Mhm.
So you have to learn everything under the sun. And sometimes that means learning things that you don't necessarily enjoy. So dental school was interesting in the sense that you're expected to do and see all these patients at the same time you're expected to study for all these exams. So it was very difficult to kind of juggle both of them. But obviously you have to learn it all. But versus residency, you pick that field and you you love it already. So you're essentially just working. For me, I picked a very, like I said, clinically based program, and it literally just felt like I was out in the real world working and making a salary, but under this umbrella of a school and hospital. So I thoroughly enjoyed my residency. Now, obviously it's different for every specialty, but me personally, I thought dental school was a lot more difficult than residency.
Right. So how are your days like at residency? Like, were they long days? Like, school is like long and studying. So how were there like tests or exams and studying, and what was that?
Yeah. Residency, I would say, I mean, everyone's experience is different, but for
Yeah.
me, residency was a lot more manageable. I would say you have these different rotations, but mainly you're based in your school's clinic. So you're seeing a whole bunch of patients, and then some seasons you'll be out doing rotation, like an anesthesia rotation or an oral surgery rotation. But it has to do with, it's all encompassing with pediatric dentistry. So again, because you've already picked the field that you're interested in, everything um like in residency you're already interested in, and it's kind of like it gets real in residency. You're like, I better learn everything I can because the next step after this is I'm on my own. So
Right.
I would say in dental school I was forced to learn all these things, but in residency I kind of like tried to absorb as much as I
Right.
can because I knew that this was my last step of being protected under a school
Yeah.
institution before I kind of like spread my wings and was out by myself. So yeah, I would say residency, you do study a little bit. There's exams here and there, but it's not as
Mhm.
intensive as dental school.
Gotcha. So in dental school, so was it in dental school that you decided you wanted to be a pediatric dentist, or like when you got that summer job?
Yeah. So I always knew I like gravitated towards kids. So I kind of had an idea that, somewhere along the line, I would kind of mesh healthcare and kids. So I already
Yeah.
had an inkling that I would do pediatric dentistry, which is why I interned at a pediatric dental office. But I also knew that I wanted to keep an open mind and that could change throughout dental school. So
Right.
throughout dental school, I kind of came in with a default of pediatric dentistry, but I tried to keep an open mind in case anything else sparked my interest. So I was willing to let pediatric dentistry
Yeah.
go if I found something that was more interesting. But that didn't happen, so I stuck with pediatric dentistry.
Did you have a second option? Like, what would be like the next thing?
Not at all. I had
Nothing.
nothing sparked anything. It was pediatric dentistry all the way. It ended up being that way.
Gotcha. And so, how was your, I guess, the process of applying? Do dental schools kind of guide you through how to apply to residency, or is that just all on your own?
Yeah, so there's no course for it. So, but the seasons come, like application season comes. So in dental school, you kind of know when to start looking out for applications and when interviews are and everything like that. So
Mhm.
I would say my best advice is, you know, s- try to explore as much as you can. But once you find a specialty that you're interested in, have a group of colleagues or friends or classmates that are kind of in the same boat as you so that you guys can do everything together and remind
Mhm.
each other. Luckily for me, like my best friend was also pediatric, going towards the pediatric dentistry specialty. So we kind of reminded each other, oh, look out for this, look out for that, applications for this
Yeah.
school coming up. So my best advice is just to surround yourself with people who are kind of on the same journey as you, just so you guys can keep each other in check.
Right, makes sense. And is it typical for people to apply to more than one specialty, or is it just like you're set on one thing and you just go through that?
Yeah. So I would say it's very unusual for someone to apply to multiple specialties at the same time. Now,
Mhm.
I know a couple of people personally who, in pediatrics, I think pediatrics is the one specialty where you can have two specialties because it's very closely aligned with orthodontics.
Okay.
So I've had friends who started their pediatric specialty. They were already in their residency, and then
Mhm.
that's when they realize I don't want to do just pediatrics, I want to do ortho. So pediatric dentistry is an interesting specialty because it allows you to do it doesn't allow you to, but I would say they intersect with
Okay.
another specialty, which is orthodontics, but
Mhm.
it doesn't really, all the other specialty don't really intersect. So you wouldn't
Right.
have two different, different interests, you know? I
Mhm.
would say the only ones that really intersect is maybe orthodontics and pediatrics.
Gotcha. And how competitive would you say, I guess, specialty in general to get in, and then also pediatrics? How like competitive was that, and what are kind of some things that they're looking for in an applicant?
Yeah, honestly, I think everything is competitive nowadays. I feel
Yeah.
even dental school is competitive,
Mhm.
I'm sure. And I
Of
feel
course.
like it's only going to get more competitive. Now, the big difference between residency and dental school is that in dental school, you can apply to as many programs as you want and kind of like increase your chances of getting in if you're not picky with location and
Yeah.
programs. However, for residency, you can apply to as many as you want, but it's a match program. So you only get accepted to one, you get matched into one. You don't have all these
Oh,
options of,
wow.
oh, I got accepted to these 10 schools and I can pick from these 10 schools. It's a match that works in both sides. So you have to like the school and the school has to like you. You rank them at the end of your interview process
Mhm.
and then they match you. So sometimes if you really like a school, but they didn't really like you or ranked you
Yeah.
below, you can end up losing a spot and just not getting matched that year. So
Oh, wow.
in that sense, residency is very, very stressful because you can be a great applicant, but because of the match system, and we
Right.
don't know what the system is, it's just this crazy like analytic that they
Yeah.
do.
Algorithm.
Yeah, algorithm, and you have no idea. So some of the best applicants don't get matched the first time, but obviously, my advice is to keep trying until you get there. So I do think it's competitive in a different way because you don't
Okay.
have all the options.
And how many like in your class, how many people do you think chose to go to a specialty versus general dentistry? Like,
Yeah, so it really depends on your dental school. I went to UCLA, and UCLA is known for kind of breeding specialists.
yeah.
So a lot of my classmates ended up specializing, but a lot of other schools breed general dentists, which is great because you have this great foundation of everything under the sun with dentistry. So I don't know the numbers to be
Mhm.
completely honest, but I would say from my dental school, most people specialized.
Right.
Mhm.
Okay. Makes sense. And when you entered residency, what was the learning curve like? Were you shocked by some things, or was it better than you expected?
Yeah, it was definitely better than expected.
Yeah.
In dental school, you're kind of left to fend for yourself. You see patients by yourself without a dental
Mhm.
assistant. So if you need a dental assistant, you're begging and pleading for your friends to help you become an assistant. And that's if
Yeah.
they're not seeing their patients as well.
Right.
So residency is so much. It's kind of like graduating, right? In dental school, you're just barely surviving, and then in residency you're kind of, it feels like you're working, you have assistants, and then but you're not making that dentist salary.
Yeah.
And then when you're out in the real world, it's like super rewarding because you're getting
Yeah.
everything, you're getting rewarded with the salary and everything. Um so yeah, I would say there was nothing like shocking, but
Yeah.
I definitely felt a lot more supported as a resident. And at that time, when you're a resident, so when you're a dental student, you're like a dental student. When you're a resident, you're a doctor. So they treat you like a doctor. So you kind of feel like, you're valued, um, like a crucial part of a team. So I would say residency it was great for me.
Perfect. And so you went to Yale. How many other residents were there with you?
Yeah, so Yale's program, there was six residents per class. So since it's 2 years, there were 12 of us, but in each class, entering class, they only accept 6 people.
Oh, okay, wow.
Yeah.
And who's kind of the train, like who's the head of who's teaching you, I guess? Is that a pediatric dentist or like a professor?
Yeah. So in residency, we call them attending. So they are a mixture of everything. So some are full-time faculty. So
Okay.
they chose to just be in academia. So they're not practicing clinically. And then some are part-time faculty, which means they have their own practice that they practice at, and then um, they become an attending for maybe like 2 or 3 days out of the week. So
Gotcha.
you have those, are attendings are the ones that are overseeing your work and kind of lecturing you and like, giving you all the tips and guiding you through your residency.
That makes sense. Okay. And then so your residency, what was like what do you think was the best advice you got in residency when you were then let out to your to the real world, and what do you think is one thing you remember the most?
Ooh, ooh, that's a good question. I think the one thing I learned in residency that I will take with me is just the connections that you make.
Mhm.
So, dentistry, no matter where you are in the world, it's a very small community. So everyone knows each other, and the relationships that you build, even in starting in dental school. I'm still pretty close with a lot of my dental school classmates, but dental school residency, you've gone through these 2 years with the same people. You see them
Right.
every single day. So even if you didn't get along on a day-to-day basis, when you're out, you appreciate the time that you had with them in residency, and you guys kind of went through the same experiences, so you appreciate that aspect of it. So I would say building connections is a very crucial thing. I'm still very close with my program director. When I was taking my oral boards, I was like hitting him up for advice. So just make sure when you're in residency that you build these long lasting relationships. I'm still friends with the assistants I once had, like very personal, close friends. So, just keep in mind that, these are people that are helping you in your path to your profession. And, you want to appreciate how they're helping you and the role they're playing in that path to becoming a dentist. So I would say building close connections is the most crucial thing that you can take out of any aspect of your journey.
Okay. And so you mentioned boards. Is that like connected? So like when you finish residency, is that like right after, or is there like a set month for that?
Yeah, so it's a little complicated, but there's two type of boards. One is a dental board, and you need to pass that in order to practice dentistry. So
Okay.
dental boards you do before you graduate in dental school, and
Okay.
then there's a separate boards that you do for your specialty, and that is actually optional. Not everyone has to take be board certified to be
Hmm.
to do your specialty. It's just that extra notch to kind of I would say advertise yourself as someone who kind of went above and beyond to
Right.
take that exam. So oral boards, depending on what program you go into, there's two parts. There's a written portion and then an oral portion. The written portion, usually residency programs build that curriculum into the program so that you can at least pass your first part of the boards. So at Yale, we did have a course specifically to prep us to pass the written portion. Now, once you pass the written portion, you're out in the real world, and then it's your choice whether you want to proceed with completing getting board certified by taking the oral boards. So oral boards, they only allow you to take it if you pass the written portion and
Mhm.
you've been practicing, because they want you to have some real world knowledge of
Okay.
pediatric dentistry. So I actually, just because of COVID, mine got pushed back and kept getting pushed back. So I actually just took mine this last month. So I don't even know my results yet.
Oh,
So
okay.
we'll see.
Well,
Fingers
yes, hopefully. Hopefully. Okay, so how was it getting a job out of residency? Was it hard to find a job or pretty easy?
Yeah, I would say for me, I was the type to just want to go on vacation for a whole month because I've been in school for the longest time. So I
Okay.
wasn't as anxious getting a job right off the bat. But of course,
Okay.
fate has it that it happened like that. There was a great
Yeah.
opportunity that fell on my lap, and then I had the option to start immediately. I mean, I was able to get like a couple weeks off to go on
Mhm.
vacation, but I would say if you're not picky, you will get a job, but most keep in mind your first job isn't going to be your forever job. So don't be stressed out about finding that perfect job. Chances are you're going to be jumping around, and chances are you're going to have multiple. As a dentist, I don't know if people know this, but you have a lot of like multiple part-time jobs. It's very rare that you stay in one office. Most people have a couple days at this office and a couple days at another office, so that's actually the norm. So, and then you build up, how many days you want to work in a week. But I would say don't stress yourself out about finding a job you need or finding your perfect job. Just be open minded,
Mhm.
be open to private practice, corporate dentistry, anything to kind of get some experience under your wings. And then if you find that you don't like it, it's not a big deal to find another job. In dentistry, you don't get dinged for like, when you like see your application, they're like, why were you only there for 3 months and then you switch? In dentistry, it's very common to kind of jump around, but be careful because like I said, the network is very small. So you don't want to burn any bridges. So you want to do your due diligence and be
Right.
respectful of everyone's time.
All right, makes sense. So you mentioned how you were seeing like 75 to
Yeah.
100 patients, which
Yeah.
I can't even wrap my head around
I
because
know.
that's
Sometimes I can't
amazing.
wrap around either. Yeah.
But how was that transition from going to like residency and then that? Because I can't imagine like
Oh,
how
yeah.
how was that for you?
It's a big jump. Anyone, no matter what program you went to, there is no way a residency program can see the same amount of patients. So I actually went to what we call a high volume residency program,
Okay.
and that's like 20 patients a day, like max, right? 15 to 20 patients a day, and that's considered a lot for
Yeah.
residency.
Mhm.
Now, when I came out to the real world and I was expected to see 75 to 100 patients, of course that was a big jump. Okay, so I would say the first 3 months of working out in the real world, I was exhausted.
Mhm.
Obviously, it takes some time to build up your speed and efficiency. But the most important part is, even though I'm seeing those 75 patients, I want to make sure every patient's experience is as, I want to make sure they're getting the time and the tailored treatment that they need. So you never want to feel rushed, right? So I learned to work efficiently, but not compromising the quality of care or the quality of the experience I'm giving to my patients. And that's totally doable. Like I said, sounds like an outrageous number, but it's doable when you have the proper support. So you'll see that at my office, the assistants support me so much. They do a lot of the things that a slower practice might have the dentist do, but because we're a high volume practice, we have the assistants do it for us. So that's a major help. But it definitely took some time to get to a point where I felt comfortable, seeing this amount of patients.
Gotcha. And are I guess are employers hesitant to hire someone right out of residency knowing that they're gonna be seeing high volume patients?
Yeah, it really depends on your employer. So every like owner is different. Um, I would say, they're not, I don't, sometimes it depends on what they're looking for. Some owners love new residents because they can kind of tailor the way that a person practices. Say, for example, if you've been practicing out in like for 5, 10 years, you kind of are set in your own ways and you're set in the
Yeah.
materials that you use, the things that you like to use, and you're a little more picky in the way you practice. So in that sense, some owners don't like that because they want control of their own practice. So sometimes they actually gravitate more towards new residents. But it really depends. Some owners are not very trusting because they don't know the quality of work because you're just out of residency. So it really depends on the owner. But I definitely think it's even par. I would actually think most people like younger dentists or fresh out of residency because we're up
Mhm.
to date with all the new guidelines and all the new materials that are out there, so we can offer that to the patients. Because I know dentistry, you can really get set in your own way. So if you've been practicing for 50 years and you're not keeping up to date, your practice will get very outdated. So some people like new graduates.
Gotcha. So I know like with general dentists, they will refer a patient that might be difficult, like a pediatric patient. So have you ever faced something really difficult and like how do you kind of, I mean, obviously you have to treat them. What is kind of the next step you would take if this is like really difficult?
Yeah, that's a great question. That's the crux of pediatric dentistry. When you think about it, anytime you specialize, you are the last line of
Right.
like you're it. That's
Yeah.
your specialty, and you are, you know, expected to take care of that patient. So, in pediatric dentistry, what you really learn is it's not about the technical aspects of dentistry. It's more about problem solving skills. You have a patient and they need A, B, and C, but in order to get that done, like how are you going to provide that treatment? So, obviously there have been cases where very specialized cases where maybe like a patient can't undergo general anesthesia because of their medical history. So you really have to, a good pediatric dentist will kind of think outside the box and see what they can do for that patient. So it's kind of MacGyvering your way through a treatment and discussing with the parents all the options that can be done. So it's not very textbook in pediatric dentistry. You really have to look at everything case by case
Mhm.
and do your best to provide the best quality of care for that patient and treat your patients like they're your own, like your own children, because at the end of the day, you're the last line of defense, and you want to provide quality care that other dentists cannot provide. So, you're equipped with the tools. It comes with experience. So you have to know what your options are. And depending on the age, you can talk to parents how they feel about more conservative or more kind of extreme approaches. But it's really problem solving skills when it comes down to it.
Gotcha. And I know you mentioned when you have like complex cases, it will usually get referred, or do you still practice at the hospital?
Yeah, so it really depends on whether you have hospital privileges.
Okay.
We personally at our office don't have hospital privileges. So if we can't do an in-office or general anesthesia case, we will have to refer over to the hospital.
Okay. And that's where a different dentist who does have hospital privilege.
Yes, it would be another pediatric dentist with hospital privileges or privileges at a surgery center.
So how do you get these privileges? Is like another test or?
Yeah, yeah. So in terms, it's different for every hospital. So
Okay.
usually hospitals are affiliated with academia. So at Yale, a lot of our attendings had to be basically affiliated with our school to have hospital privileges. But it's different in every hospital. Every hospital has different requirements, but it's not a test or anything. It's just a series of paperwork that you have to get certified, and all these background checks for you to get hospital privileges. And usually your either the owner of that practice has already established some type of affiliation with the hospital or something of that sort. It wouldn't be like you would just walk into a hospital setting saying like, oh, I want hospital privileges. You have to kind of be connected with already an office.
Gotcha. Okay, that makes sense. Okay, so I know like there's technology is always changing. So what are some ways that you kind of stay up to date with like the dental, I don't know, I guess technology or new things coming out that might help your practice? Are there like conventions you go to
Yeah,
or?
yeah, yeah. Yeah. So we, as a dentist, any field you're in, you're required to do what we call continuing education courses, and it just kind of essentially it forces you to kind of stay up to date with everything. And there's a lot of dental societies and associations that you can join that where they mail you new the latest greatest things of pediatric dentistry. And
Yeah.
I do take some time to read that, just because you never want to be that outdated dentist. You want to be up to date with everything, and be open-minded enough to try it in your practice. So I think that's very important, and I'm glad that we have the continuing education. Otherwise, I feel like
Right.
dentistry will never progress or grow. So that's an important aspect of being a dentist in general.
And do you think or the way that you learned it in dental school, were they up to date as well, or did you kind of have to learn some things on your own?
Yeah, I would say when you're a resident, you learn, or a dental student, you learn everything by the book. And a lot of people tell you it's like, oh, by the book or reality. So there is a major difference between, what they teach you, like what the literature says, as well as how you actually practice. Sometimes it's not ideal to practice what the literature says. Um, so yeah, there is a major difference, and it comes with experience and time outside of residency to learn those different techniques. But I would say in the beginning, the first couple months out, I was very by the book, and then luckily I have a great mentor who kind of showed me the ropes, and it's up to me to kind of see where I draw the line
Right.
of mixing the two.
Gotcha. Okay, so you mentioned debt and dental school. How, I guess, is it like a stressor that's always on your head, or is it kind of, I don't know, what are your feelings about where you are right now and with a specialty?
Yeah, yeah. Okay, so obviously, like, when you're in dental school and you're taking out all this money, it's
Yeah.
like it's crazy, but I've learned to just not think about it for my own sanity, because
Yeah.
everyone's going to come out with loans anyway. Now, it is, I think, your responsibility to make sure you minimize the loan amount as much as possible. But you unless like your parents can pay for it out of pocket, which is not common,
Mhm.
you're going to have some loans. And people, even if they're not in healthcare, will have loans, a house loan, a car loan. So you'll never kind of get away from loans, but you can do your best to minimize it. So my advice is, while you're in dental school, try to minimize the loan amount that you're going to have to owe. But once you're out of school, you will be able to pay it back with your salary. It's just a matter of time. I would say I'm all about short-term sacrifices for long-term rewards. So when you're in dental school, don't be using your loan money to like go on crazy vacations or parties or anything, because you're going to have to pay that back, and like that's going to be multiplied after interest. So, be very financially conscious, but don't let it bring you down. Don't like, everyone's going to have loans. So it's a part of life. So don't let it kind of hinder you from taking next steps, or, doing like, a lot of people are scared of taking out more loans possibly for residency. Don't let that stop you.
Okay, perfect. Thank you. So you did mention scholarships. Is it I guess, is it often that dental schools offer scholarships? And was that kind of a factor in you deciding where to go for dental school?
Oh, yeah, definitely. So I would recommend looking into every single school. There are national scholarships as well as school specific scholarships that you can apply for. I would apply to as many as possible, because you never know if you're going to get it. A lot of them are merit based. So if you already have a high GPA and really good grades, really good DAT scores, definitely look for those merit based scholarships, because you most likely will qualify. In terms of my decision, I didn't get any scholarships. So I just went to the school. I got lucky because the school that I wanted to go to was in-state public school. So I got really lucky with that. But even now looking back, even if I didn't have that option, I would definitely just pick the school that has the lowest tuition, just because, like I said, in the end, we're all going to be dentists, and no one really looks at your dental school or like residency, to be honest. The only time that I felt like my residency or schooling mattered was when like a parent was being very condescending and asked like, where did you go to school? And I said Yale, and she was like immediately just like,
Yeah,
that was the only
it
time.
was worth it.
Yeah. Yeah, but in the end, we're all dentists, and we're all going to be doing the same thing at the end of it all.
Gotcha. Okay, last question. How do you de-stress? You talked about physical strains, mental strains. What are your favorite things to do to de-stress, get it all out of your system? What do you do?
Oh yeah, I love that question. I would say it's a must when it comes to pediatric dentistry. In terms of like the physical strain that I feel, yoga helps relieve my back a lot, and it's very calming. And having time to myself, like, and not like being expected to talk to anyone or anything, like
Yeah.
silence and alone time is very important for my mental sanity. So that's kind of like the little things that I do. I promise it's not that bad, but it's definitely something to consider.
Yeah. Gotcha. Oh, well, thank you so, so much, Dr. Judy. I mean, the Q&A session was amazing, but then your presentation was awesome as well. We really, really appreciate you for coming. Is there anything you want to say, or follow, I guess, Dr. Judy on her social media accounts?
Yes, yes. I just want to thank you guys so much. I think this is a great thing that you guys started. So thank you so much for hosting, and thank you for inviting me again to do this talk. I had a lot of fun.
Of course, we enjoyed it as well. So thank you everyone for watching, and that is it.